So welcome guys once again, and in today's video we are talking about some important term we can use in the hematology, and it is very important for the upcoming year exam. So it contain number of terminology which we can connect with each other, and kind of revision we can take from this different types of term, right? So first of all we have a hematopoiesis. What mean? The production of red blood cell. So in this there is a production red blood cell which we call as hematopoiesis, which occur in the bone marrow, right? It is a part of bone marrow. Another one is erythropoiesis. Erythro means RBCs, poiesis means production. So the process of RBC formation, production, the same thing. So it is known as erythropoiesis. Leuko means WBC. So production of WBC come under the leukopoiesis. Similarly, thrombopoiesis, platelet formation or production, which all this happen inside the bone marrow, right? Bone marrow. But in case WBC, when we talk about the T lymphocyte or B lymphocyte, mainly T lymphocyte, so they are formed in the bone marrow but matured. Important term, mature. They mature in the thymus, right? Very, very important. They mature in the thymus. Then another one we have a plasma. So plasma, what is plasma? Plasma is the liquid part of blood which is 55% in portion, and rest 45% our RBCs and 1% mixture of platelet and WBC, right? Which we called as a Buffy coat, right? The term is also known as a Buffy coat when the platelet and WBC combine during centrifugation, right? So at the low we have seen the RBCs, in middle we see this platelet and WBC, and in the top we see the plasma, right? Another one is serum. So serum is a plasma without clotting factor known as a serum, which clotting factor mainly absence, so we can say fibrinogen. So sometime direct question come from the question book, that which factor absent in plasma and which factor absent in the serum while present in the plasma. So the answer is fibrinogen. Fibrinogen is absent in serum while present in plasma. Another we have a hemoglobin. So what is hemoglobin? Hemoglobin is present inside the RBCs. What is the function? Function is responsible for oxygen transportation. So it transport oxygen. Not only they transport oxygen but carry CO2 from the lungs to the outside, right? So from the tissue it carries CO2 to the lungs, and from the lungs we exhale it, right? Now another one we have a hematocrit. Hematocrit, which another name is PCV, pegged cell volume. So it mainly define the percentage of RBC in the blood cell. Percentage of RBC in the blood cell, right? Erythrocyte. Erythrocyte mean RBCs. What they do? They do transport oxygen, right? Transport oxygen is the main function of erythrocyte, commonly asked in the question exam maybe. Another one is leukocyte. Leukocyte क्या है? Defender of the immune system. So they mainly defend the immune system over, right? Like an army. So they prevent some injury or outside infection when the outside or foreign particle came inside our body. So the leukocyte activate and kill it as soon as possible. Next we have a thrombocyte, which is we called as a platelet. So what is the main function of platelet? Blood clotting. So they help in blood clotting, right? When during the any injury, so primary function of, or we can say primary clot formation, it is due to the platelet, blood clotting factor, right? Another we have a red bone marrow. So what is red bone marrow? It is a part of marrow, right? Bone marrow are divided into two parts, red bone marrow and the yellow bone marrow. Red bone marrow is the active site hematopoiesis. So regularly it carry out and maintain the RBC's production or another type of cell, right? Hematopoiesis not only denote the RBC, it also carry the erythrocyte, leukocyte and thrombocyte and all other cells, right? So in the red bone marrow there is active site, always formation of hematopoiesis, right? While yellow bone marrow it is not active site, it is a passive site which we seen the storage of fat and can produce RBC in emergency. So during the emergency stage, when the body need a high amount of RBCs. So at that time, yellow bone marrow converted into red bone marrow, but until that it become a inactive stage, right? So main function is store fat, right? Then another we have a reticulocyte. So reticulocyte called as an immature RBC. So reticulocyte are the immature RBC, or we can say juvenile form of the RBCs. Or so many times the question asked in the exam, right? So it is a type of MCQ, not MCQ, some terminology you can understand. Maybe it come in sometime exam. So kind of revision we have, right? But if we go deep, then for the particular this reticulocyte, so reticulocyte are the stain with supraorbital stain, right? And they are in number 0.222%. So if I make video in this format, the video is going above 3 to 4 hours, right? So it is a different thing. At this time I am discussing some words, so you can just correlate or recall your memory, right? Another one is granulocyte. So WBC divided into two parts, granulocyte and agranulocyte. Granulocyte, as the name suggests, it contains granules such as example neutrophil, eosinophil, basophil. So neutrophil are the most abundant, right? And basophil are the least in the WBCs. Another we have agranulocyte, means there is no granules such as lymphocyte or monocyte, right? So these are the example of agranulocyte. Another, if we talk one by one, so what is their importance? In case of neutrophil, it fight the bacterial infection. So against the bacterial infection, we see the neutrophil, it also engulf, right? There is a word attached with this neutrophil, engulfing, right? Another we have a eosinophil. Eosinophil mainly play a role in allergic or parasitic infection. Another we have a basophil. Basophil, it release histamine and promote inflammation. So kind of during the allergy reaction we can see this basophil also participate, but main role done by the eosinophil. Or in the parasitic infection, very very important parasitic infection, we see the eosinophil increase level. Another we have lymphocytes, so include B cell and T cell for immunity. It maintain directly control the any foreign particle, mainly the viruses. Not only viruses, overall the microorganism, they are they kill the microorganism and protect our body from them. Another WBC we have a monocyte. This is a large one. One important thing about monocyte, this is a large one, okay, large one, convert into macrophage and engulf pathogens. So when the monocyte is present in the bloodstream, so they known as a monocyte, but when it enter into some tissue, so they become a macrophage, right? So they become macrophage, and it also help in engulfing pathogen. So it directly engulf, or we can say eat the pathogens and protect our body. Now second is we can talk about the anemia and blood disorders, right? This is also important. So anemia, what is anemia? A condition low hemoglobin level. When we see the low hemoglobin level in the blood, then this is called as anemia. So we have a different type of anemia such as iron deficiency anemia. As the name is iron, so it means there is deficiency of iron. The most common type caused by iron deficiency. So mainly in the India or all over the world during pregnancy, or mainly the female, this is a common reason. Anemia is due to iron deficiency, right? Because so many menstrual cycle or another nutrition deficient play role to increase this iron deficiency anemia, right? So that's why it is important during pregnancy, or in any, when the doctors see that there is patient with anemia, so directly continue the tablet, take iron, right? So it is directly linked, but not as usual, right? So we have to perform some test to identify it, like a iron deficiency, serum iron level, TIBC test. So these are the different tests, right? Another we have a megaloblastic anemia. So this is due to the vitamin B12 or folic acid, right? B9, we can say B9 to folic acid, B12. So these two vitamin play important role to cause a megaloblastic anemia. And my throat is like a thirsty cow. Another one is a pernicious anemia. As the name suggests, pernicious, it is due to the problem in vitamin B12 absorption. So when there is a deficiency of vitamin B12, this is called a megaloblastic anemia. But if the B12 is present but is not absorbed by the body, that it means due to pernicious anemia, right? So it is very important. So here the intrinsic factor play an important role, right? They can help in absorption, but if this intrinsic factor does not present in the gut area, so it will lead to the pernicious anemia. Another, we have a hemolytic anemia, which is the most common anemia, right, caused by RBC destruction. There is so many problem that cause the RBC destruction. So basically, when there is directly linked to the RBC destruction, it will lead to the hemolytic anemia. Another, we have a sickle cell anemia. As the name says, sickle, in this case, the RBC become, if the RBC is like that, so it become in a sickle shape. So I'm sorry for the noise outside. There is no any kind setup which will be a noise free. In future maybe we will try, but at this time continue please with that. Another, we have a aplastic anemia. Aplastic anemia, the bone marrow fail to produce RBCs. So basically, in case of aplastic anemia, bone marrow fail to produce RBCs. Not only RBCs, during the aplastic anemia, all the three cells, WBC, RBC and platelet, all three cells are down. Another one, we have a thalassemia. Thalassemia, it is a genetic disorder, right? It is a genetic disorder caused by abnormal hemoglobin production. So in this, we see the production of hemoglobin is abnormal, right? Not proper. Then polycythemia, it is a condition increased RBC count. When there is a increase in the RBCs count, then that is known as a polycythemia. Another, we have a leukocytosis. As the name suggests, cytosis means increased condition and penia means decreased condition. In the leukopenia, decrease RBC. In the leukocytosis, increase WBC count. Then we have a thrombocytopenia, low platelet count, thrombocytosis, increased platelet count. Hemophilia A. Hemophilia A due to deficiency of vitamin it is a deficiency due to the factor 8. Another one, we have a hemophilia B, which is factor deficiency of 9. Okay, 9 from the 9 deficiency we see the hemophilia B. From the 8 we see the hemophilia A. Another one, we have a von Willebrand disease. So it is a type of disorder in which we see the there is no any formation of clotting, right? Von Willebrand factor, important factor, and if the von Willebrand factor is absent, then automatically hemophilia A is also present, because factor 8 present on the surface of von Willebrand factor. Another one, we have a disseminated intravascular coagulation. This is a condition, it is a rare condition, but it is a very dangerous condition, because there is both type of death-like situation for the patient. One is, there is a huge amount of clotting. Another one is, due to the huge amount of clotting, all the clotting factor are involved in this clotting, and as a result patient may bleed, and both the condition lead to the death for the patient, right? Because excessive clotting, there is no circulation of blood inside the body, and if the patient is become alive from this excessive clotting, then they will be definitely dead by this bleeding, okay, because the clotting factor are involved in this mechanism of the clotting. Now we have a hematology lab test and parameter. So first of all, we have a CBC, as the name suggests, complete blood count, measure all the blood cell count. Remind the word count, it's count the all blood component or cell. Another, we have a MCV, mean cell volume, indicate RBC size. In case of RBC size, mean cell volume. MCSC, measure the average hemoglobin amount in the RBC. So it mainly measure the hemoglobin level inside the RBCs. MCSC, indicate hemoglobin concentration. In case of concentration, we can go for the MCHC, mean corpuscular hemoglobin concentration, but in case of average hemoglobin amount, so we go to the MCH. And then another one is RDW, red cell distribution width. It mainly tell about the variation in the size of RBCs. If the small size, large size and medium size, so different type of RBC present. So this is measured by due to the this RDW, right, from the red cell distribution width. And what is the term we call to this? Anyone can please comment. So I will give an example: endocytosis or poikilocytosis. So these are the two terms. So if anyone know which is the right term for the variation in the size of RBC, they can explain or comment. Now another, we have a peripheral blood smear, microscopic examination of blood, reticular count, bone marrow RBC production में how many we have a retic count. So it mainly evaluate the RBC production from the bone marrow. ASR detect inflammation, or in indirect way we can say that we measure the how much level of plasma present in the blood sample in a particular amount. In case of PC, we see the how much amount of RBC present in the tube, vast region tube, right? CRP indicator inflammation or infection. Hemoglobin electrophoresis is a technique used to detect the abnormality of the cells. Maybe we can see the sickle cell anemia or another type of anemia plus thalassemia, which is very important. We do the electrophoresis. Serum ferritin, it mainly tells us the iron storage in the body. TIBC, total iron binding capacity, it measures the blood iron carrying capacity. So how much the iron carrying capacity, which will be tell us by TIBC. Coombs test, DAT or IAT, direct Coombs test or indirect Coombs test. In the direct Coombs test, as the name is direct, the RBC is linked with the sensitized antibody. Just we have to add a HG, anti-human globulin. But in case of indirect, so firstly we have to sensitize, then after that we add the HG, anti-human antiglobulin, and if it will react, so it is IAT. Mainly done in case of autoimmune hemolytic anemia, right? Now we go to the another part, blood coagulation and clotting. I know lots of things are missing in this, also come in my mind, right? Like CRP, RA factor, there is so many things, but let it be. जितना how much we can, देखो मेरे से कितनी हिंदी निकल रही है but क्या, we can't make this channel into two languages ना, so I don't know what to do. Sometimes I think we have to create some another channel for the Hindi people, but let's see. I shifted to somewhere else where I have no any proper setup as previous, and the background noise is too much annoying me, so that this is the reason why I stopped teaching online. But still I have promised we will make some video for the ICMR, or we can say that ICMR. We will make video for Aiims CRE. So for that kind of promise I will make in this video, right? Another, we have a coagulation. The process of blood clotting is known as a coagulation, right? Platelet count, which is a part of clotting factor. If we have a low platelet count, so patient see the bleed, it measures the platelet level in the blood. BT assess the blood vessel integrity. So how the blood vessel is working or not is properly, which will be measured by BT, bleeding time. Another, we have a CT, clotting time, measure time taken for the blood to clot. Basically, we take the blood into the vial, and we after that we add some thromboplastin or another thing and measure how much time it to take to clot the blood. PT, measure the clotting time of the exchanging pathway. So in case of PT, factor 7 we mainly detect, or in case of INR, it is an international standardized ratio which measures the PT test, right? Basically PT range here may be different from the another country, but international normalized ratio, we can say it is standardized, so we can't change the amount of medicine we are giving, like heparin. These doses are mainly decided by this INR ratio, how much amount we can give to the patient in case of any clotting, right? Because they are the anticoagulant, artificial, right? So we give that, but based on this INR ratio, very, very important. Another we have a APTT, activated partial thromboplastin time, measure intrinsic clotting pathway 11, 12, 8, 9. So these are mainly detected by this APTT. D-dimer test. Sorry, I'm speaking last from I think 18 to 20 minutes, so the throat is literally going to kill me. Anyway, D-dimer test, marker for blood clotting breakdown. So when there is a blood clot formation, the body automatically break down it. At the time it releases D-dimer. So we can test with the D-dimer kit if this is planned treatment, there is a breakdown of clot. So it is very important in case of DIC also, right? Another we have a fibrinogen, which is a part of blood coagulation, help in blood clot formation. Fibrinogen is one of the important part which help us in the clot formation. Another we have blood banking and transfusion related. So number one term is blood grouping, as you all aware of this. Blood type classified based on ABO RS system. So we have a ABO, blood group A, B, AB, and if there is AB absent, then it means O, and based on RH positive negative. So we have a different type of blood groups. Universal donor is O negative, right? Universal donor is O negative. You can learn with donor having O and this O. Universal recipient, AB positive is a universal recipient. Cross matching, it mainly helps to checking the donor and recipient blood compatibility, right? Before giving blood to any of the recipient or patient, we have to cross match, and this is due to the cross matching process. Checking donor recipient blood compatibility. Another we have a direct Coombs test, IOD, to detect antibody in the RBCs, on the RBCs. If direct sensitive, we can identify the sensitized antibody, but in case of indirect Coombs test, we have detect the antibody that may cause transfusion reaction. So in this case, the procedure is that we have to first sensitize the RBC and after that we detect. So free antibodies, we check if there is any free antibody is present or not. In that case, we do the IAT, indirect Coombs test. HDN, hemolytic disease of newborn baby, occur due to RH incompatibility. So this is a common feature, RH incompatibility, which is HDN. Autologous transfusion, the patient receive their own blood. So there is 2-3 type of this transfusion, autologous and some another name I am skipping at that point. Then we have apheresis, a technique to separate the specific blood component. Mainly we have a whole blood and we separate the plasma, RBCs, platelet, or we can say the WBCs. So these are different type of component we separate through this technique called as apheresis. Cryoprecipitate, a blood product with rich in factor 7 and fibrinogen. So cryoprecipitate we give to the patient who having a deficiency of factor 8 or fibrinogen, right? Another we have a fresh frozen plasma. It contain all the important clotting factor 8, 9, 10, 11, 12. So it contain many of the clotting factor. Packed RBC, transfusion only for RBC. So if patient have a number of destruction of the RBC, so at that time we give the packed RBC. Whole blood, in case of blood loss, we give patient to the whole blood, but in case of only RBC destruction, so why we increase the circulatory overload, right? If we give the whole blood, so the load of the volume may be increased in the patient. So at that case we give packed RBC, but in case of blood loss, we have to give the whole blood. Bone marrow leukemia. So although if we target about the particular bone marrow, it will take another 20 to 25 minute video. So I am planning make that video also, right, if possible. But I will make continuous 5 to 6 video which will help you for your exam. So let's talk about the bone marrow. Bone marrow aspiration, detect the bone marrow disease. So basically we aspirate, or there's two types of bone marrow testing. First from the aspiration and from the biopsy. So we aspirate the liquid or we take the part. both are different thing, right? Another one is in case of leukemia, blood cancer affecting WBC. So increase number of WBC, ultimately leukemia. How many type? 4 type, meaning acute lymphoblastic, as the name says, lymphoblastic, most commonly in childhood leukemia. Then acute myeloid. When they come acute, it may lead to the infants or the children, because in case of chronic, patient needs some time to develop a disease, or we can say cancer. But in case of children, if there is any disease, so it will occur very fastly. So that's why if the term comes acute, it means it related somewhere for the children, right? Acute myeloid leukemia and aggressive cancer of myeloid lineage. Chronic lymphoblastic leukemia, slow growing cancer, common older adults, while in case of lymphoblastic acute, it is for childhood. CML. So one of the common feature of CML is chronic myeloid leukemia is Philadelphia. We see the Philadelphia chromosome. So this is a video. I know it having lots of some missing details, but if I will make add all this point, I know the video is going to approximately 2 or 3 hours, and we'll try on Sunday. I will try on Sunday. If the video have some positive response, so definitely I will try to make 1 to 3 hours approx video which contain many of the things and helpful for you, and we go some deep level also. So at that time, but right now this is some important details, you can note it, and you can also join our channel, Telegram channel. You can get the link in the description. I will put this PDF on that channel, and you can also get the Hindi version also, right? So on there you can get also Hindi version. So vice versa, according to your need, you can go to the Telegram channel and enjoy it in the PDF form, so you can learn it more. Thank you and have a nice day.